Cancer is one of the leading causes of death worldwide, with a staggering 8.2 million deaths in 2012. Health experts warn that annual cancer cases will rise from 14 million to 22 million within the next 2 decades. Globally, the most common cause of cancer death is lung cancer, followed by liver, stomach, colorectal, breast, and esophageal. In the Philippines, lung cancer is also the top cause of cancer-related deaths among men and the third cause of cancer deaths among women, outranked by breast and cervical cancer. Here today is reviewing cancer and a vision for better healthcare.
Sigurado ko kung gusto ninyo ang inyong mga immune matunggan kalukuyan. Will take a very short break and then vinegar will continue on with other things do you have in mind that you believe to end your needs and that which first world class care kaya natin ibigay ng mga tao dito sa Pilipinas. It is a very better and whatever the problem Welcome, dear viewers and listeners, to Dynamic Living the Total You. This is your host, Dr. Jean, and we are doing our episode on cancer and a vision for better healthcare here in amazing Visayas, right at the very heart in Cebu City. I am very much honored to have with me our cancer specialist. He's a medical oncologist, as well as the medical director of Allegiant Regional Care Hospitals, Dr. Alex Alegrado. Welcome to Dynamic Living, Doctor.
Thank you, Dr. Loreche, for having me here. Thank you to Dynamic Living for the kind invitation, and it's really a pleasure to be here.
Yes, of course, it's also a pleasure on our part because we know that our viewers will understand a lot from you, no? Knowing na you have been in training abroad as well as locally, and this is actually your forte. So let's start off by asking you, hetong cancer, Dr. Alex, we know that statistics has it na parang it's on the rise, not just nationally in the Philippines, but worldwide.
That's true. I agree. It's predicted that in the next 20 years or so, there will be an increase of about 30% incidence of cancer. And similarly, there's going to be an increase in the percentage of death from or mortality from cancer. And it's increasing because of a few factors. For example, there's already better equipment to be able to diagnose cancers at the early stage. And the most important thing is basically the knowledge of the Filipino people that cancer exists, there's a treatment available, and now we have experts that are actually here in
just
the
like
Philippines.
You. So, ibig sabihin nito, Dr. Alex, for our viewers' sake, pag sinabi natin rising number and expected to rise pa, ibig sabihin nito, siguro, if we translate it to numbers, siguro some out of 10 or out of 20 people, may have the possibility of developing cancer.
That's true. It's actually very scary because the statistics would state that up to 1 in 4 women and 1 in 3 men will actually have cancer in their lifetime. So the risk is there, and this is something that our government or even our own selves should be aware of so that we might be able to do something at an early stage. Yeah.
Pag sinabi mong heto 1 out of 4 in men, 1 out of 3 among women, pare-pareho ba ng klase ng cancer meron sila o magkakaiba?
So still the most common for women is breast cancer and the most common for men is prostate. But I would like to allude that in our next few talks would be that the cause of mortality is actually lung cancer. So I'm alluding to that because that's actually one of my special interests and something that's very close to my heart in terms of treatment and diagnosis. But like what I said, yeah, it's actually different for different individuals. Risks are also different for individuals, even by sex and by age.
So let's talk about sex and let's talk about age ngayon. Kasi syempre sinabi mo, iba pag babae, iba ang paglalaki.
Yeah.
But somewhere along the line, there will be an overlap. In other words, merong mga pare-pareho na whether babae or lalaki, magkakaroon sila in the same organ.
Correct.
Pero we will be discussing that on the second part kasi yun na nga, that is your special interest. No?
Right.
So let's talk about children also. Ang mga kabataan din ba, are they also, at increased risk for cancer?
Right. So there are actually cancers that are unique to children, for example. So let's talk about lymphoma, leukemia, for example. These are, or other hematologic malignancies, they are actually common among children. And there are also genetic factors that plays early onset of cancer among people. So yeah, I agree. There's actually a cancer in the young as well. So that's a different specialty, in fact. And I will have to give kudos to our pediatric oncologists who deal with a lot of these cases. Yeah.
Nakakalungkot kung ibig sabihin na meron din sa mga kabataan na meron din tayo sa mga matatanda. But what is the common age group? I mean, in general, we're talking now about cancer in general. What would be the common age group na meron talagang hetong big C na ito?
Right. So cancer is generally a disease of the old. So I would say the risk increases as you grow old. Yeah. And the reason behind that is because if you really talk about malignant transformation, or when you talk about how does our normal cells become cancer cells, you know that the normal cells are actually regulated by genes, and they're regulated by factors, and they go through a process of cell cycle. So in this process of cell cycle, actually, there's a glitch. I just made it as simple as possible, that there's a glitch in the gene or genetic diversity of that patient, and then instead of the cells dying, it actually continues to grow. And it requires multiple mutations. So just imagine as the cells grow, they die, they grow and die. That takes years also. So the older you get, the more process, this process actually take into action or takes place, and more what we call defects, or somehow the genetic machinery are not able to repair as you grow old. So that's why I said cancer is basically a disease of the old population, or the old generation.
Di ba, for the sake of our viewers also, itong mga cancer cells, normally, sinabi mo nga kanina, the cells are supposed to be regulated.
Right.
But when it happens to become the big C, there's no control whatsoever.
There's no control, yeah. So, but it takes a few mutations, or a lot of mutations, for these actually genes to become what we call oncogenes, right? So oncogenes are basically the genes that when their function alters, that becomes a cancer or malignant transformation. And there are extrinsic and intrinsic factors that causes the mutation. So let's talk about the extrinsic
the ones
factors.
that are, sa labas,
not inherent to the individual.
person.
Yes. So extrinsic factors, like I should say the number one would be lifestyle. So the food we eat, our diet is actually one of those. Lifestyle, which also includes smoking. So as we will talk about smoking also in the second segment of this talk. Your stress in life, for example, the chemicals that we use, the in preservatives,
our food, the environment, the air that we breathe in.
Correct. Pollutants, for example. So these are external factors, or we call extrinsic factors. And the intrinsic factor that I'm talking about is something inherent to the body, whereby you have a genetic predisposition to it. So this is what they say, it's hereditary, right?
That's why we get to see, Dr. Alex, na, families, it runs in the family.
Right.
Like one family will have, several members of the family being affected of a certain type of cancer or different types of cancer.
Yeah, you call it like familial syndromes, for example, or hereditary cancers, for example. But we should all understand that 80% of the cause of cancer is actually extrinsic, meaning it has something to do with lifestyle. And 20% of that is
Will it mean
genetic.
better hope for people? Kasi syempre, if it's genetic, there's nothing we can do. Or can we do something about it?
That's true, actually. So when I said that it's actually 80% lifestyle, from the onset, you have something that you can actually do, right? And then it's something that you can modify. Yeah, but like what I said, intrinsic age is something that you cannot modify, right? So genetics is something that you cannot modify also, but we don't try not to lose hope because we can still do something about it.
Yeah, pag sinabi mo na intrinsic genetic, hindi naman natin pwedeng piliin kung sino yung kapamilya natin, di ba?
That's true.
But we can do something about it.
Yes, at this day and age, we have a lot of things that we can do now.
Are there what we call also na very specific, are there what we call a pre-cancerous lesion or
Correct.
pre-cancerous condition para naman aware yung mga tao nakikinig sa atin na nanonood na heto if I have this, then I have to be very, very careful. I need to seek examination.
That's true. So since I think majority are women, in the awareness is like because of the publicity of breast cancer, for example, a lot of women are aware about benign breast lesions, for example. So, and women are getting treatment or screening, for example, for if they have a lump in the breast. Then they will go for screening. And a lot of those people will have findings of like a benign breast lesion, for example. So it doesn't mean that benign breast lesion, it doesn't translate to malignant transformation or becomes cancer. So there are benign breast lesions that actually can translate to a higher risk for breast cancer. And if you consider it together with other factors like hereditary, age, and environmental factors, for example, then it can transform to malignant transformation. So the point I'm driving at is that at this early stage, we can actually do something about it, right?
And one would be being, aware of what's going on inside your body.
Right. So, and it's also important for, I think, our patients to understand what's the implication, basically, of getting this kind of diagnosis, for example, like breast cancer lesion. So, I think one of the take-home message that I would want for this particular scenario is that they should seek the proper consult because sometimes they get a lot of misinformation from
Actually,
different areas.
that's the thrust of our show, no? To be able to give them the correct, remove the myth and the fallacies from there.
That's
kasi
true.
mahilig ang mga Pinoy, bibili ng gamot kasi iniinom ni kapitbahay.
That's
okay,
true.
pumunta kay ganito kasi pumunta si kapitbahay, no?
Yeah.
Pero in terms also of signs and symptoms, is there something na, in general, we're talking now about generalities for cancer, kasi we'll go into the specifics later, na are there some things that they need to watch out for really so that they would know, okay, I really need to seek my consultation?
Right. So, different primaries, or we call the sites of onset of the cancer, will manifest differently. And it's something systemic. But there are general things that you can watch out for. Like, for example, significant weight loss, and then some form of bleeding. Of course, you can feel some masses, right? And so different scenarios and different primaries will have something unique to them. So let's say colon cancer or rectal cancer, for example, some of them would manifest with bleeding or changes in the caliber of stools, for example, or changes in the amount of stools that they have. Breast cancer, sometimes it's a lump. Yeah, so lymphoma, for example, will present with B symptoms like fever, weight loss, night sweats. So I think it's very important that if you don't, you know it actually that you don't feel well, and you know that there's something wrong. And once you get that feeling that there's something wrong, I think the next step should be to check and have consult at least maybe a general practitioner, a primary physician.
Pero kasi ang problema natin lalo na yung mga kalalakihan, binabaliwala nila. Carry lang nila, di ba?
That's true.
So it's when it's already at the very terminal stage, that's when they seek consultation. Let's talk about treatment modalities or options kasi marami naman yan sila. Pero let's start with the very basics also.
So the basics of treatment, basically when I tell my patients, there's 3 general approach to treating cancer. So number 1 is surgery. So plain and simple, you remove the cancer. Second is radiation. Radiation, to simplify things, it's basically like burning the cancer cells. Then you have chemotherapy, right? And then chemotherapy nowadays are divided into conventional and then the targeted treatment that we have. And conventional is the old chemo that we have. They're still very useful at this day and age, and but we know better now in terms of managing their side effects, right? Which we will talk later on also. And then we have what we call targeted treatment. So this is something that I really want to emphasize, that there are now drugs available that are less toxic, but very good response rates, meaning they're able to to do justice in terms of treatment and cost effectivity, right? And then, of course, the hot topic nowadays is actually immunotherapy.
Yes, which we will discuss on the second half.
Which we will discuss also because, you know, as you can see, it took some flight. I mean, like a really big leap in the treatment of cancer. It started with melanoma, and then actually lung cancer followed suit thereafter.
Yes. So we have all of these treatment options, no? Pero in terms of side effects, or let's start with indications muna.
Right.
Like not everybody can go through surgical removal of the
True.
tumor.
That's
o
true.
kaya naman not everybody would be good candidates for radiation or for chemotherapy.
Right.
Is there a general rule by which we can, educate our viewers na if this is what would be, the person would be best suited for a surgical operation, and then things like that?
Yeah. So the staging that we usually follow is the TNM staging. So T stands for tumor, N for nodes or your lymph nodes, M is for metastasis or spread. And depending on the tumor size, the nodal involvement, or whether it has metastasized or not, we can basically classify cancer as stage 0, 1, 2, 3, and 4. So it's a spectrum. So 4 is really the advanced stage, and the aim is different compared to when you have stage 1, 2, or 3, in fact. Yeah. So in general, I'm just saying in general, that when it's an early stage, you want to remove it as much as possible. So that's when surgical intervention becomes very important.
So ibig sabihin, hindi din pala lahat pwedeng i-operahan.
True, that's true. Yeah, doesn't necessarily mean that if you have, or even if you have stage 1, for example, it doesn't mean that you will have to go for surgery.
May mga certain indications,
Correct,
diba? So
yes.
the importance there is for the patient
To know.
and the relatives to know and understand and talk to their doctors.
Right. And I should say, and important also, is that we have to consider that cancer treatment is multidisciplinary. It just doesn't involve the medical oncologists like us. It has to involve the radiation oncologists, the palliative and supportive care doctors, the surgeons, for example. And by doing that, actually, we can improve the survival of patients. So studies have shown that multidisciplinary team actually improves the survival of cancer patients.
People sometimes shy away from chemotherapy or radiation because ang kanilang feeling parang naririnig nila napapabilis, napapadali tuloy yung pagkamatay ng kanilang kamag-anak o ng pasyente nila. Why is that concept ganon?
I think it's a misconception because chemotherapy, actually, depending on the stage, can actually cure patients. Let's talk about lymphoma, for example. Even at an advanced stage, you can cure lymphoma with multi-chemotherapy modality as well as a monoclonal antibody. It's a misconception because I think media has played a role also. What you see in the clinic is different from what the media is telling you. So, of course, the media will sensationalize, sorry to say this, but sensationalize things, and what the people actually hear from are those what we call horror stories rather than successful stories. So in my practice, for example, you don't get to hear about those patients who graduated from my clinic, right? And it's not being advertised at all. So like for example, in one of the institutions of Singapore, they have celebrated a successful 100 patients plus of transplant patients. But you seldom hear all these things. So I should say it's really a misconception. And another thing is that another factor that contributes to this misconception is basically the medical field also. Because some physicians, even if I'm trying to be bold here in saying that some physicians will really give chemotherapy even if there's actually questionable indications. So
in other words, it's more of not just educating the patients, no, but also we are trying to educate our colleagues also.
As well, that the things, you yourself has to grow in terms of knowledge as well. Like you have to update yourselves on the current worldwide standards.
We'll take a very short break, and when we return, we'll continue on with our discussion. Basically, we have discussed the basics of cancer, what it is all about, and how we should be able to understand in terms of choices, treatment modalities, the risk factors. When we return, we'll continue on with our discussion here with Dr. Alex. Please stay tuned to Hope Channel.
We are people, and we love to get connected. We connect as families because of birth. We connect as friends because we click. And we connect as communities because we care. Seventh-day Adventists are people who connect in communities called congregations, which in turn connect to form conferences, who connect together to form unions, divisions, and the General Conference. Why do we connect? It starts with a connection to the Creator, who invites us on a spiritual journey. When we journey together, we can help each other along the way. This journey is a journey of a lifetime, and as we learn and grow, life becomes filled with meaning and purpose. Our greatest joy is in helping others along the way. Wherever you are on your journey, we believe that we have something to offer that can make your life more whole. So the next time you see a Seventh-day Adventist, remember, you're not looking at someone who stands alone. They are connected to a world church that has 18 million members, gathered in 13 divisions, comprised of 122 unions, formed by 600 conferences, serving in 140,000 congregations in 208 countries, who worship in 924 languages, and they all want to connect with you.
Actually, kung cancer ang atong isgutan, digi ko ganahan. Pero kung naay cancer maabot sa kong kinabuhi, ako na lang ang amiguhon, himuhon ko na lang barkada. Ay di man siya mo gawas sa kong lawas. Pero ako sa ignon nga, kung di ka muhawa, ini kamatay na ako, apil po ka. Mas may pagmuhawa na karon kay basig makakita pa kaglain customer. Once ka ako mamatay, apil ka. Basta kung may mo, ayaw lang ko hatagi og pag-antos ning kanser. Kay kung tagani mo ko long run nga pain, I prepare to die.
Pinakakuan gyud ng nasa internal organs bitaw nga cancer, sir. Kay lisod man gyud na siya, di ba, kasagara lisod siya matambalan dali-dali. Kay naaman siya sulod sa atong ginhawaan. So kanang kasagara baya kay mangita ka sa mga kanang mga mag-transplant, di ba, milyon-milyon ang imuhang pangitaon ana nga kwarta kung naang galing kay kwarta. Pero di wala pag kasiguruhan nga maayo gyud na siya. Kay kanang cancer good nga. Tapos kung ang atong pangayon sa gobyerno ana nga naagi ka ng mga prove nga tambal mga mahatag nila kung para makatabang sa mga labi na sa mga pobre nga dili maka-afford sa pagpatambal sa mga specialty bitaw nga mga doktor kana mga mahalon nga hospital. Sa mga tao pod nga maglikay pod sa ilang nga kaunon nga dili makadaot sa lawas.
Sakit-sakit sa cancer, lalaki man sakit sa cancer, pero ako wala magikuy sakit sa cancer. Ang ako lang nga mag-amping lagi sa kong pang lawas na ko, ana, kay di man nga sakit ang cancer, wala man sa sa among kaliwat jud, ana. Ang amo kuan lang okay ra gyapon nga walay kuan walay gibati nga mga sakit. Wala sa una nako na sa una sa akong kanang igagaw, sakit sa cancer sa tutoy, kay katuin tutoy nanan man nya mo to na kuan siya. Pero katukid kuyawan lagi ko atusin ato ka sakit pero sa amo ginakuan pero wala man sa ako. Kato ra igagaw nako sa una. Nung nakasakit og cancer namatay gito sa sir kay sa cancer sa tutoy man to iya. Oh, ya duka na sad to. Nabusa karon naka kuan ako karon nga magakuan gi ko sa akong lawas nga maayo di wala kay di sa ko gusto anak kay kuan binang sakit sir kanang cancer. Pero wala gina sa ako. Gusto ko nga mag-amping lagi sa akong pang lawas nga maayo ko ana.
Cancer kanang cancer sa breast. Kay kuan man mahadlok ko kay mergyap kay kuan man na siya imong tutoy. Operahan. Depende man siya sa cancer sir kay kung first siya pero bisag minor cancer lang mahadlok gyapon ko kay mamatay man gyapon ta. Kuan, siguro sa mga hospitals magbutang sila og mga kuan dadto. Libre sa mga cure sa cancer kay dili gyud bayatanan kay nabagbaya pobre nga nagikupoy cancer so kailangan sa hospital nagyapoy free nga libre. Libre nga opera sa cancer, sir.
Breast cancer, maybe breast cancer yun tingali. Kay common man gud siya sa mga babae ba nga sakit. Maura ako ma-explain. Number one, good, eat healthy foods. Number one, then, exercise for me. Di magpabaya sa lawas.
Welcome back to Dynamic Living, the Total You. We are still here in amazing Cebu, and we are actually very much honored to have with us our cancer specialist, Dr. Alex Alegrado. And so, during the first part, we were discussing the basics of cancer in general. But now, let us focus on your topic
interest.
and special interest. Hindi person of interest, but the topic of interest now. So sinasabi natin na Dr. Alex na ang lung cancer cuts across borders. In
Right.
other words, babae, lalaki, bata, matanda, meron siya. May pinag-aralan, walang pinag-aralan, meron siya. Why is that?
Yeah. So, in terms of statistics, although it accounts for about maybe 13% of all cancer causes, it accounts for 30% of mortality.
Mataas.
Mataas, yeah. So I'm saying it's both for men and women. So that's the number one cause of death from or mortality from cancer. It's lung cancer, and so let's talk about the risk factors involved. For example, so smoking is really rampant, and it's one of the causes. And I should say that secondhand smoking itself is also a risk factor. In
Pag
fact,
sinabi mong second-hand smoking, Dr. Alex, for the sake of our viewers
Yes.
and listeners, heto yung hindi ikaw naninigarilyo mismo.
yes, that's true. And then if in the household, for example, is if one of the parent is smoking, or your husband or your wife is smoking, you're also exposed to carcinogens coming or being emitted from the smoking process itself. And there are studies that would indicate that secondhand smoking is even dangerous because you inhale more of it, and there are actually more carcinogens that being excreted through secondhand smoking. So one is risk factor is really high. So that's also a reason why lung cancer is really rampant. And
Will
it's there.
genetic play a role here? Like for example, if my father died of lung cancer, me as a child, would I, growing up, would have also an increased risk for developing lung cancer?
All right. So there are syndromes that actually alludes to lung cancer being a part of a syndrome, but majority of the cause still is through lifestyle. So probably there's an exposure because you live in the same household, right? So probably the son or the children are actually exposed to smoking. So that's why there's also an increased risk of cancer.
Is there such a thing as progression, Dr. Alex? Like for example, may problems sa lining epithelium ng sa lung parenchyma mo, heto nagsimula ng ganito, tapos magiging full-blown cancer siya.
That's actually correct. If you remember when I stated earlier that it requires multiple mutations before a normal cell actually happens or it manifests itself. So it's the same thing as what the cell would manifest histologically.
Yeah, pero ibig ko sabihin, one cigarette a day, will it really be the one that will trigger for one to have cancer? O kaya naman, kailangan 5 packs a day, 10 packs a day, and the number of years that that person is
Right.
smoking.
So that's what we call number of pack years, right? So it's basically the number of cigarette smoke that you consume as well as the duration of your consumption. So the higher your exposure and then how deep your intake of the inhalation of the smoking actually increases the risk of cancer manifestation, especially lung.
But pero kung sakaling may naririnig tayo, 'di ba, sabihin nila na I have been a smoker 3-pack for 15-20 years and yet I stopped. So when I stopped, like
Yes.
for example, is there also such a thing as, okay, since you stopped, then you are cleared from having the disease?
Okay. So two things there. There's what we call genetic polymorphism. So that means more individuals, some individuals are actually prone to getting cancer when they smoke, and some, when even if they smoke for like a long period of time, they don't get any cancer. So that's what we call genetic polymorphism. And okay, let's say when you stop smoking, so how will that impact in the incidence of cancer, for example? Of course, the moment I mean, if you stop at an early age, the better it is. That means you don't induce more mutations. You don't induce more, you don't inhale more carcinogens in your body. So usually what we say that when we try to categorize patients who are smoking, we have the heavy smoker, the non-smokers really who haven't really tried any cigarette in their lifetime, or the what we call previous smokers. So in our risk stratification, we say that if you've stopped for the last 20 years, that's only the time that we say that you're actually a light smoker.
20 years,
yes, yes, yeah.
What are the signs and symptoms that a person may have and feel na, okay, since I know I'm a smoker, okay, I know that I have secondhand smoke exposure, heto yung dapat kong bantayan. And when I get to have this, I should be able to seek consultation.
Yeah, that's very important also for people to recognize. So, since it's primarily a disease of the lung, so common symptoms like shortness of breath, chronic cough. If once you think about chronic cough, that's actually your differential for you have to rule out cancer.
Pag sinabi mong chronic cough, yung ubo na nandyan, gaano katagal?
Yeah, more than 3 months, for example, that it's you're coughing and it doesn't go away. Weight loss is still a significant factor to consider. If you have all this plus weight loss, this is something that you have to think about.
So, wag mong ibaliwala, in
Correct,
other words.
yes, yeah. And then loss of appetite, these are generic symptoms that you will have, So, constitutional symptoms, for example.
So, what do they expect when they get to see you? For example, they go and see you, Dr. Alex, I saw you on TV, and I have the symptoms. So, what are you going to be the workup for this particular kind of patients?
All right, so let's talk about those patients who doesn't have the cancer yet, but they think that they have the risks or the exposure to cancer. So, in 2015, we already approved low-dose CT scan as a screening tool, right, for lung cancer. So that's the, they conducted a study, and then it shows that it actually improves the capture rate and eventually translate into a better survival for patients.
In other words, hindi na chest x-ray lang, low-dose CT scan. So that's something new, okay?
That's low doses. So 2015 it was approved, right? So that's like two years ago.
Yes.
So, but this is something that we have to educate people also, that there's also such a thing. Now, it's different at the other end of the spectrum. So, depending on the stage, right? So, let's talk about advanced cancer, because that's
the
end of the spectrum. So, majority of my patients would manifest already an end-stage disease, or meaning a terminal illness. So, what we usually do, the first thing is, and this is the dictum for oncology, is that you should have a histologic diagnosis. We have to prove histologically that it's cancer.
Because there are different types of cancer in the lungs.
Exactly. So,
how does it impact in terms of prognosis, in terms of treatment choice, in terms of lifespan for the patient when there are different types of histologic for the cancer of the lungs?
It's very important. It affects all the factors that actually you mentioned. So let's talk about lung cancer in general. So lung cancer is generally divided into two, which is a small cell lung cancer and non-small cell lung cancer. So small cell lung cancer is 20% of the time, and then majority is non-small cell lung cancer. So for now, small cell lung cancer, the standard of care is chemotherapy, and there's ongoing studies now on bringing immunotherapy up front. So I'm still waiting for the results of that trial, and it's a totally different treatment or a management plan compared
Pag sinabi mong immunotherapy here, kasi parang ang pagkakaintindi ng mga tao, when you go, the immune system is being built up in order for them, to be able to fight against whatever foreign bodies that come in. Pero immunotherapy as used, to treat cancer, how is it, and how come na, this is now being integrated in the management of patients?
Yeah, so that's a very good question. So for the lay people to really understand what immunotherapy means, so you have a cancer cell that's actually growing in your body, and supposedly your immune system will be able to recognize this cancer cell as something foreign, right? But our cancer cells are smart enough to release regulatory factors and put a stop into this recognition to the tumor cells. And I mean the immune cells, right? So the immune cells will think that this cancer
Part
cell
lang.
is actually part of the system. So they live like something
Together.
like symbiotically in that sense. So immunotherapy, what does immunotherapy do? So what we actually tell what I actually tell my patients is that we give a drug, it's still an infusion that actually awakens your immune system so that block that was given by the cancer cells will be cut off, and then these immune cells will now start functioning and do its job of recognizing cancer cells as foreign, and they actually kill it, right? So that's basically a simplistic term. It's a complicated process, but that's
Yes.
the most simple way probably of telling
And is this being done today, right here in our setting in the Philippines? Is it being practiced? Like, are cancer specialist doctors really going into the, offering this option of therapy to their patients?
I hope so, and I would think so, because there's no question about how updated our oncologists are. But I think there are other factors to consider when we talk about immunotherapy. Yeah, so like for example, the cost implications. So I think we will have to discuss that also separately
Yes.
in terms of. But I just would like to go back to how we classify the lung cancer, whereby it's small cell and non-small cell. So small cell, like what I said, the standard of care is basically chemotherapy at this point in time and trying to bring in immunotherapy. And then that's non-small cell lung cancer is further divided into basically 4 major subtypes. And the most common is still adenocarcinoma. Yeah. So it's a good topic to discuss because not because it's actually common, but adenocarcinoma now has multiple treatment options at this point in time. And so let's talk about stage 4. So let's say you get an adenocarcinoma as a biopsy. You don't stop there actually. So what we do
So, kumbaga, it's not an end-all na, okay, alam ko na diagnosis ko, okay
and then
na
I will
ako.
give you
Or you'll
this
give you this.
blanket treatment. No, it's
hindi
not like
ganon.
that.
Okay.
So what's happening, what we are supposed to do is basically do further testing. We call this gene testing or even single gene testing, for example. So what do we test for? So we test for EGFR, ROS, ALK, CMET. So these are some of the few examples that we have targeted treatment available. So what do I mean by targeted treatment? So once you identify the gene that's actually mutated, so basically it's like this. I told you that there's a mutation, right? And then there are multiple factors that cause the mutation.
In other words, yung mga genetic composition ng tao, lahat tayo will have our genes, we have our chromosomes and everything. So there's a problem somewhere along the line.
Yes.
And so we're trying to map that out and check saan dito ang may problema.
Exactly, and we call them driver mutations. So what's the most dominant gene that's actually causing this cancer? So let's say you're positive for EGFR. Then there's a treatment available for you. And some of them, majority of them are actually oral
So
forms.
hindi na kailangan na i-inject pa,
Right.
admit sila.
Correct.
So this time, it makes it easier on the part of the patient.
Yes, and not only that, the side effects are very manageable. And
Kasi
then,
di nga ba, isa sa kanilang
Yes.
contentions, why they don't want to go through chemotherapy is because of the side effects
That's
that
true.
they get.
Yes.
So in targeted, let's make it clear, no? The targeted therapy is minimal ang side effects. At
Yes.
sinabi nga na targeted, so ibig sabihin, it's really directed directly to what is the problem.
yes, so like what you said, targeted treatment, you know your enemy, so you know who to target, basically. And then because of that, because it's so specific, that the neighboring cells or the standby cells are less affected compared to your chemotherapy, right? So I use the term manageable because they do have their own peculiar side effects. And it's a matter of managing and knowing what are those side effects.
And usually, what
Yeah.
are the side effects?
So when we talk about tyrosine kinase inhibitor, this is just one of the drugs that's available. Some of them would manifest like skin rashes, for example, onycholysis, changes in the... So these are things that you have to recognize. Facial rashes, for example, because if you don't pay attention to it, complications can set in. So let's say skin infections. Yeah. So like what I said, it's manageable, and knowing how to manage them is very important for the oncologist.
So, yung ibig sabihin, when all these tests come out, and sabihin na natin na you are going to be a candidate for this type of particular treatment or drug that is orally taken, how does it impact the life of this patient? Like, for example, kung ang ating 5-year survival rate, when we talk about survival rate in terms of years, ilan pa ba ang buhay na kasama mo na na-diagnose at ginamot in 5 years, diba? So, when you give these targeted chemotherapeutic agents, how does it impact the life of the patient?
So let's talk about response rate, for example. Response rates are the ability for it to do its job or function, meaning the ability for it to control the cancer. If you compare it with conventional chemotherapy, you talk about at best 30% response rate, conventional. But once you identify the driver mutation and you have a targeted treatment available, it can go as high as 60%.
Wow. So it increases the lifespan of a patient from, say, sabihin mo 6 months, pwedeng umabot ng 3 taon.
That's only response rate I'm talking about. So there's also progression-free survival and overall survival. So progression-free is different. That means from the time you are diagnosed with cancer, when do you get another progression of cancer or the resistance of cancer, right? That also is increased with targeted treatment. And the most important thing, which is the gold standard of how our drugs are actually measured, is the overall survival. So it increases your overall survival. Like what you said, from 3 months to probably a year, for example.
So medyo mataas din, ano? But in terms of cost, how costly or how cost effective it will be to our patients?
So if this is what I always tell them, if it is something that will give you a good quality of life and you're able to function, I think it's very cost effective. That duration, that overall survival that you get from the intake of these drugs, the implication does not stop there. Also, we have to go back as to the the diagnostic also, because determining these genes are also quite expensive, right? So, and this is something, let me just put in something in terms of like my vision in trying to improve the standard of care in the Philippines, is that hopefully with some lobbying with the government, that I'll be able to bring in a molecular lab in the Philippines whereby we can centralize all the testing, and it makes the cost per test much cheaper if we set, like, different institutions would send it out somewhere abroad, right? So what I'm doing now at this point in time is actually send everything to Singapore for testing for my local patient, and that entails costs, right? Yeah. So just imagine if I have it here.
But aside to your vision, which we will be talking later about your vision, let's talk about quality life. You mentioned something like, by giving them this targeted therapy, knowing which is the right one for the right patient.
Yes.
You're trying to individualize, personalize the management.
Yes.
So you're actually improving quality of life here.
Yeah, that's true. So that's one of the goals. Why are we treating them in the first place? It's because one is we want to cure them if we can. Second is because we want them to live longer with good quality of life. Yeah, so it's important. I think the hardest part of being a medical oncologist is really to say to patients that I have nothing else to offer. And it doesn't mean that I will not care for you. It's just because I think that the drugs will not do you any justice. So I think for me, a good doctor will be able to say, hey, there's this kind of treatment that's good for you, and then it's a correct treatment, it's the standard of care. And then at the same time, a good physician should be able to tell the patient, hey, there's nothing much we can do, but these are things that we can do at this point in time instead of chemotherapy or targeted treatment.
Yes, we'll continue on with that discussion, Dr. Alex.
Yes.
We'll take a very short break, and when we return, we'll continue on with the train of thought that you have, your vision for our patients here in the Philippines. Please stay tuned to Hope Channel. We'll take a very short break.
Number 1, then exercise for me. Di magpabaya sa lawas mo.
Breast cancer and cervical cancer. Mostly gyud karon mga babae kasagaran problema nga ato na encounter sa mga babae kan breast cancer and cervical cancer. Mo ini kasagaran. And then basta breast cancer and cervical cancer. May akong greatest fear. Siguro kuan lang siya kanang ang information kinahanglan gyud nga i-spread siya ang information bitaw nga kung naanay bation ang usa ka babayi nga magpa-check gyudayon siya. Kay mas maitong earlier ma-check siya para kung unsa magalito ma-prevent siya mintras sayo pa. Then kung pwede na atay mga vaccine free para ana nga mga cancer kana cervical, kung pwede ang breast cancer ma-appeal siya. Actually sa cervical wag na naman tay vaccine. Vaccination ana wag na pod sa government. So kana lang vaccine ko para ma-prevent, then information good sa mga babae nga kanang bation sa ilang lawas nga di nila masabtan dapat ipa-check gid siya aron mahibawan earlier the better.
Colon cancer. Ako. Since yung pinsan ko kasi nagka-colon cancer siya. So, nagpa-colonoscopy ako. Nag-undergo ako ng colonoscopy with gastro. And then, yun, may routine akong ginagawa para, yun kasi risk factor ko nga, yung possible na magkaroon since genetic siya.
I think na dapat paglaanan ng government ng budget para sa isang facility na magkaroon tayo ng isang place na lahat ng cancer patients ay doon pupunta.
Sa palagay ko, ang kailangan nating bansa ay proper knowledge how to prevent cancer in the Philippines. Unang-una, sa mga pagkain natin, dapat malaman ng mga tao yung pagkain nakaka-cause ng cancer. Ikalawa, disiplina ng mga Pilipino. Dahil lang sa bawal manigarilyo, mag-inom, cause of cancer, at saka iba't ibang mga pagkain na dapat ay iwasan natin para tayo hindi magkaroon ng cancer. At saka isa pa, dapat ang mga Filipino doctors ay magkaroon ng sapat na kaalaman para ma-prevent ang cancer sa ating bansa. Pagkat nababasa ko sa ibang mga pahayagan, sa ibang bansa, ang cancer na-cure na. Pero sa atin, dumarayo pa ang mga Pilipino para magpagamot sa ibang bansa.
Welcome back to Dynamic Living the Total You, our dear viewers, with our episode, Cancer and a Vision for a Better Health Care. At andito nga po tayo ngayon sa studio, dito po sa Cebu City. At ang ating guest at panauhin natin ay si Dr. Alex Alegrado, isang medical oncologist. Dr. Alex, before we took off the break, we were talking about quality life
Right.
at saka yung vision mo. Pero bago natin pag-usapan yung iyong vision, let's talk about hetong yung alam naman natin, alam ng mga tao na your family is actually in the hospitality business, in hotels, in resorts. What made a change now na para bang heto you are now venturing into the hospital industry?
So that's a good kick-off when you say quality of life, because majority of us would think of hotels, resorts as it's a place to heal, a place of warmth and compassion. And the people within the resort area are actually very accommodating. They say hi to the guests. You know, they actually take care of you in the best possible way. And it's not really far from the hospital business, whereby once you merge those two, just imagine when you step in, the moment you step in the hospital, you feel like your healing starts. Because the people are very warm and very compassionate about your care. And we envision something whereby the patient's journey is actually very good, and then the healing process is also something that will be very amazing. So I want to change that notion whereby when you go into the hospital, you say, you know, you go there to die, basically, or you go there to get mistreated or misdiagnosed. So you go there because there's sincerity in the way we actually treat you and your journey as a patient.
You've been trained abroad.
Yes.
And of course, you come from this amazing place here in Visayas, in Cebu. Have you seen, or what can you see in terms of a difference? Let's just talk about one or two major differences. The way your experience in outside of the country and your experience now here in the Philippines as a medical practitioner.
Right. So in terms of the gap or how we lag with our colleagues abroad, I should say it's really far. The gap is really wide. So when I practice there and I practice here, when I say I do lung cancer and then I ask for tests, the tests that's available, the drugs that's available, it's there. But here, it's quite a challenge for me to even for the diagnostics. It's quite hard. So so that would bring me to my point whereby I would love to see that kind of standard of care here in the Philippines.
And you believe that it is attainable?
And it's doable. Yeah. So although we need help, it's doable. Yeah.
You mentioned that you are actually interested and you are going to work on having those diagnostics readily available here in our place. So you envision that to become the center for diagnostics, not just for lung cancer, but for cancer in general.
Like cancer per se, yeah. So that's only one aspect actually. So it's important, correct diagnosis of patients. So I think that's the first step, number one. But most importantly is the care of the patient. So there are other factors that I'm trying to bring in, like for example, the hospital information system. So our HIS system will be coming from Singapore also. And it's a clinical HIS, something that's the usual step would be to go for something that deals with billing or accounting system, but this one is really clinical. So how does that impact? So just imagine whereby when you step into the clinic and then your doctor already knows exactly what you're having through, or there's already the medical reconciliations. And another thing, it minimizes or even lessens the error in terms of medications, in terms of everything. So that's one important aspect that we're trying to bring as well. And of course, the experts. So we are collaborating with international institutions, and I'm actually allowed to say that we are affiliated with Johns Hopkins Singapore, as well as our partner with ICON. So
in other words, this hospital that you have that will be opening very soon is actually a center, not just going to be a center for excellence, but it's a center that will actually focus on giving the best health care and attention to the patient.
So the patient is really the center of our care in this hospital. So if that's how we are supposed to do at this point in time, then that's how we're going to focus on, like bring all these experts, bring on this technology for the Filipino people.
Yes, and so I know for a fact also that your hospital, Allegiant Regional Care Hospitals, it's actually done in different stages.
Yes.
The first one would be as a general hospital, but later on you have additional other things that you would want to do in that area. And what are these, Dr. Alex?
So we are, yes, that's correct. We're actually doing it in phases. The first one will be the general hospital. And depending on the demographics that we have, the development will be catering to women's and children's hospital as well. And then we're looking into a retirement facility. And then, of course, the one that's closest to maybe your heart and my heart as well is in terms of clinical trials and research.
So there's going to be Cancer Research Center there.
Or just a general institute for learning, and that will welcome everyone in terms of increasing their knowledge. And even if we don't have the building per se, but what I'm trying to say is that the training and the education is actually going on at this point in time. So
how can Allegiant Regional Care Hospital be able to help those who are less fortunate? In other words, what assurance do our viewers, our listeners know na heto, will it be catering only to those who can well afford it, or will it also have that, close to your heart also, wherein people who are in the less fortunate status would be able to help us out?
Yeah, so thanks for bringing that up, because now I'm getting the impression that hey, it's only those who can afford can go to your hospital because you have this, you have that, and everything. But part of my vision is that it should be something that is made available for everyone. Being a leading hospital in the provision of exceptional medical care should not be limited to those who can afford only. So
what is the future? What is the future of cancer management in terms of management and treatment for us?
There's going to be a big leap, I suppose. Once we bring in all these technologies and experts, then it's just a matter of time to bring in the treatment modalities available for all of us. And we will be seeing the impact of that, maybe not immediately, But I'm hoping that in our lifetime, we'll
We
be
should
able
be
to
able-
see it in that sense. Yeah. So I hope that it will come soon also with everyone's cooperation.
Yes.
Yeah.
So what is the most important principle by which you are guided in your practice of medicine?
So when I deal with cancer patients for the last 8 years of my life, and it's really a hard and a very tragic diagnosis to have. And I think the most important thing is properly guiding these patients as to, and then trying to let them understand that this is not something unknown anymore. This is something that we know of now, and there are treatment options available for you.
Yeah.
Yeah.
Let's talk about going back to treatment options
Yes.
also. Alam naman natin, so we have targeted therapy, we have radiation, we have chemotherapy, and surgical. What about, minsan kasi ang mga tao, they opt for complementary management or
Yes.
maybe they go to herbal supplements.
Yes.
Hindi naman bago sa atin yan, lalo na
Yes.
sa mga Pilipino na kumbaga apunta na lang ako kay Manong kasi meron siyang mga ibibigay sa akin na iinumin ko lang at ako'y gagaling. What is your thoughts on this?
So, if you listen to all those advertisements, right, regarding herbal treatment, they always say at the end is that there's no approved therapeutic claim. So, that's already one indication.
That's a disclaimer already.
That's already a disclaimer that hey, you're taking this, but it will not cure you. And there's no therapeutic, value to it. So, I usually tell my patients not to go for it while on treatment because there are a lot of implications. One is in terms of side effects, will it be additive? Number one. Second is the response. How will I be able to respond, whether it's really from the treatment that I'm giving or is it something, an external factor, for example. So, and it's a matter of educating people. And then, yeah, I feel strongly about it because some of the herbal drugs that they claim, instead of actually helping, it's actually causing more trouble to the patient. Yeah.
So, kailangan pa rin beware our patients, our
Right.
viewers, na
Yeah.
kumbaga, go muna for the medical side.
They have to
Yeah.
talk to their doctors, for example. And
So,
then
mahalaga.
get the proper education and you do your own research if you can.
Pero
Yeah.
hindi naman yung research, Dr. Alex, na mag-google ka lang,
Yes,
susundin
yes,
mo na.
yes, yes.
Because you get also wrong information
That's
from
true.
the
Yeah.
net.
So proper source of information, that's the key.
Okay? Now, let's go back to quality of life. Heto nga ba, totoo ba talaga na we can really, help the patients have quality of life?
Yeah, so I can only speak of experience, for example. So I do have young patients with cancer, and then I also have old patients with cancer, and they have the same commonality, basically, that they want to be very functional, and it's attainable with proper treatment and guidance. Yeah, and it's a multidisciplinary team, like what I mentioned before. So part of the aspects that we're bringing in also is the availability of palliative and supportive care
Yes.
doctors, right? So they are very important as well.
Kasi kailangan sila, lalo na when they're in pain, when they have
Yeah, pain
metastasis
control,
already.
even emotional support.
No?
Yeah.
And even spiritual, siguro, Dr. Alex, we should be able to help them.
Yeah, your faith will guide you as well. And then maybe with government's support also, maybe later on, financial support as well.
Para medyo bumaba pa yung kaniyang gastusin.
Yes, yes.
So, as a young practitioner, a young specialist at that, coming to the Philippines after your stay abroad, what are the challenges that you believe are kind of, things that you need to hurdle?
First of all, in the practice of oncology diagnostics, very hard to attain. Like, where should I do all these things that I know of and I know that will improve or impact patients' lives? That's number one. Second is costs. So it's not like any other countries whereby they actually live a socialized reform system whereby everything is subsidized by the government. So we call medical economics. This is something that I have to relearn and relearn again, and how to improve the patient's life by, trying to make things affordable for them.
Or making do with what you have in your
Exactly,
hands.
being resourceful, or sometimes not claiming any PF anymore. Of course, just giving
So, libre
all
na lang, oh?
libre na lang. So,
So,
I mean,
ngayon,
just
nagtatanong
go
na
buy
yung
go buy medicine instead. You know what I'm saying? So, I mean, all those things you have to face.
So,
and the
ngayon,
challenge,
nagtatanong
yeah.
na yung mga viewers natin, where do they find you? Where can they find you? Sige nga.
They can, ARC Hospital, we have a website, www.archospitals.org, and then there's a email address there. Yeah.
But
that we
once
can-
the hospital is up and about, then you can actually easily contact and see you there.
Yes,
and
it's
where is this
actually
located?
it's actually in Mactan, and it's in the Maribago area, Barangay Agus area. It's in Sitio Malinaw.
Now let's talk. Let's end the show on a lighter note.
Yes.
So after talking heavily on the big C, which impacts anybody's life, everybody's life,
Yes.
not just the person, but the people around them, the health caregivers, as well as the family and the person himself. No, how do you de-stress yourself, knowing na okay, I'm dealing with patients every day. You know, sometimes it's so draining to be able to talk and relate to them, lalong-lalo na yung mga hindi nila kayang gawin, yung dapat gawin.
Yeah, that's the most common question I get. Like, after talking to patients with all these kinds of problems, right? How do you like try to divert yourself? So, I think being busy with other things like the admin stuff and all that actually makes me happy. And then in terms of how to improve healthcare, that's also something that I'm actually like passionate about. So it's something that it's like stress that makes me happy.
So, ibig sabihin, baliktad ka. Usually, yung mga stress na mga ganyan.
You want something to do rather than just do nothing.
Thank you so much,
thank
Dr.
you.
Alex. So, what is your message to our viewers?
To all the listeners and viewers out there, I mean, cancer is no longer an issue that we cannot talk about, and it's no longer an unknown at this point in time. There is something that we can do. New technologies are here. We have experts. All our oncologists here in Cebu, especially, are well updated as to the new clinical trials and standard of care. So, please talk to your doctors and try to live a good lifestyle in the first place so that you won't have all these issues.
In other words, dear viewers, lifestyle really counts. The diet, the exercise, the stress, the food that we eat, the environment that we live in, all of these factors play into being when we are talking about the big C. But at the end of the day, knowledge is power. When we know what we have and what we shouldn't be doing, this will actually equip us for the future. And even in the Bible, it says in Ephesians 3:20 and 21, it says, God who is able to do things immeasurably is actually the God that we believe in. Magandang araw po sa ating lahat.
Dynamic living, making the best of you on fire. Dynamic living, sharing the faith, we're giving the love and bringing the total you.
If you have been blessed by this program, share hope and help us continue to bring hope everywhere. Send your donations to South Philippine Union Conference through any of the bank details shown here. Hope Channel, sharing love, changing lives.
Salamat sa pagatiman sa ako lang ha. Miss,